my channel. Hope you're all doing good. Guys, today I'm going to talk about the most important domain, that is the patient safety. As you all know, part 3 is all about being a safe doctor. So it's a very obvious domain, but people are really worried about this domain. So as the saying goes, don't miss elephant in the room. So do not miss the patient safety in your task. So what does this include? Patient safety doesn't mean that asking allergies. Of course, allergy is a very important part of patient safety, but it doesn't end there. Actually, it starts from introducing yourself, okay? Like the patient should know whom they are talking to. You should check the name and age of the patient to understand whether you're talking to the correct patient, right? From there till the management, every step includes the patient safety, okay? And you are actually forgiven if you do not know a lot about the applied knowledge, but if you are not good in identifying the patient safety, then you are in deep trouble. Okay, so telling you a couple of things. As I mentioned, introduction, safe introduction, whom you are talking to, and checking the patient name and age is important. Many of the times in the reports given, generally everybody says that we after checking the name and age, but many people do not check the name and age given on the report. So it's very important what you are saying, you have to do as well. Second most important thing is asking about probably, for example, if it's a case of mental medicine, okay? So you need to tell her if the medical condition, for example, she's a diabetic and her HbA1c is 10 or 11 or whatever, higher side, you should tell her to continue the contraception till her disease is well controlled. These are all the smaller points of patient safety which you should never miss on. And of course, the allergy is important, and food allergy, drug allergy is important. If they say drug allergy, you can always ask what is the severity of the allergy, especially in cases of penicillin allergy, if she is GBS positive and things like that. If somebody says they are allergic to aspirin, always look into the history whether she was one of the indications for aspirin. Probably they would have given a advanced maternal age with IVF, and now she's allergic to aspirin. She was allergic to aspirin and she's developing preeclampsia. That could be the reason why she's developing preeclampsia, because we haven't given her any prophylactic measures, right? So such things. And also, wherever there is a history or wherever there is a need to give the transfusion, do not forget to ask about the reservations for the blood transfusion. It could be either Jehovah's, which is a religious belief, or there could be people who really do not want to take the blood transfusion. Okay, do not miss on that. Especially when cases where you are returning her to the theater or where she needs blood transfusion for her own conditions, do not miss on this. Okay, and when you come to probably the allergies, food allergies. Okay, for example, if somebody is lactose intolerant, okay, so you should be careful not to give HRT tablets, because tablets contains lactose. If you give them, then they might have allergy, right? Of course, latex allergy is very, very important. If somebody you are taking them for, even for the regular checkups or for the OT, it has to be very, very important, and that will be the first case. And coming back to the management, how does the management has a patient safety? Okay, so remember one thing, it's the patient right to know everything, okay? So for example, from conservative till the radical management, the patient has a right to know. You're supposed to be putting options on the platter and provide her. However, you will be telling her what is most suitable in a non-paternalistic way. You would say that this could be the better treatment for you for this and this and this. There is a treatment like this, but probably this is not appropriate for you for reasons like this. Okay, so justification wherever required, you need to be doing. Okay, at the same time telling them what's most appropriate for them. At any cost, as an ST5, you will not be accepting the treatment which is not correct for her. For example, a previous cesarean section, asking a home birth, you would always put more emphasis on, okay, so this is the best, probably this can, I'm really concerned about your safety and the baby's safety. That's the reason we advise you to have a delivery at hospital, because we can monitor the baby, and if something goes wrong, we have to take out the baby in few seconds to minutes, something like that. And if she insists that no, I want to deliver at home, then you have to refer her to the consultant. Do not take a decision of telling no, you have to deliver in the hospital. Okay. At the same time, you won't accept, okay, we respect your wishes, you can do what you want. Okay. And also very, very important, if somebody is pushing onto you for particular treatment which you think it's not correct, you should always ask what is bothering her. There could be a story behind that. Okay. And as well, clinical governance issues are also patient safety, like debriefing with duty of candor. Okay, so that's very, very vital and important. Okay, and in teaching task, you must remember to emphasize on the patient safety. For example, in episiotomy, keeping a crash trolley is important. Rectal examination before and after suturing is important. Like every procedure has a very few important patient safety which we generally follow. So this is not a domain which you should be scared of, but this is a domain which you have to analyze, and what you generally do in your clinical practice, you have to be telling that these are the important points. And when you say like this, then definitely there is no looking back. Okay, so this is a domain which you need to practice every day. When a patient is sitting in front of you in your consultation, think, okay, what is the patient safety for this? Am I missing on that? That's the best way to learn. And everything comes with a practice. Believe in yourself and keep practicing. All the very best. May success be yours. God bless, guys.